The center is mandated to support the execution of Africa CDC's strategic plan in the regions and provide technical support to the member states. Much as it is young, while organizing itself, the coordinating center has made considerable contribution in public health issues in the region. In emergency disease outbreak preparedness and response, including the Democratic Republic of Congo Ebola outbreak and the current COVID-19 pandemic. Through enhancing cross-border surveillance among countries and consultative meetings on information exchange, access, and use among regional economic communities and health partners. Supporting member states in the establishment of national public health institutions, building capacity, strengthening laboratory systems, and referral link in the region, conducting a sustainable eco-session for the exchange of information and best practices sharing, and facilitation of vaccine availability and support system in the region through various platforms. Altogether, these accomplishments embody the Eastern Africa Regional Coordinating Center fundamental objective of strengthening the capacity and capability of our member states and public health institutions in the region. On the other hand, much work still awaits to fully operationalize the Eastern Africa RCC, be it in human resources, finance, or technical capacity. I am sure we will all seize this opportunity to take the Eastern Africa Regional Coordinating Center's future to heart and forge partnerships for its full operation. The Coordinating Center aspires to engage with regional economic communities, mechanisms, and all health partners effectively. It also aims to link existing public health assets for responding to public health situations within the regions through regional integrated surveillance and laboratory network, or the RISLNet. Ladies and gentlemen, finally, I would like to thank all health professionals, including the rapid response team and community health workers who are contributing a lot in the theme of ensuring effective preparedness and response to public health threats in the context of COVID pandemic and beyond. And also all the member states, regional economic communities and mechanisms, and all our health partners. And again, the government of the Republic of Kenya and the Ministry of Health of Kenya for their commitment and continuous support. Thank you.
Thank you very much, Dr. Achimeles. Kindly give her, let's give her another round of applause. Thank you for setting the stage. I now want to take this opportunity to invite one of our virtual guests, Mr. John Ngengasong, on behalf of the Africa CDC, the Director Africa CDC, to make remarks. John, can you hear us? Yes.
I can hear you. Can you hear me? Can you hear me? Can you hear me?
John?
Yes,
Dr. John?
yes, I can hear you. Can you hear me? Hello, can you hear me? I can hear you. I can hear you.
Okay. John, kindly hold. Well, we set up. Once we set up, we are ready. We can't hear you. We can't hear you, but let's do the setup. Once done, we'll be able to notify you. Thank you. And I'm sorry for that hitch. We are just learning the virtual, how to handle both hybrid meetings. We are used to physical meetings, but COVID-19 has taught us it is possible to do things.
It seems everyone else is hearing me except the moderator.
Yes, as we set up, I think my apologies for that hitch. We will proceed. John, once we are ready, we will ask you to make your remarks. And sorry for that hitch. It's now my humble pleasure to invite Our Excellency Amira El-Fadil, Commissioner of Health and Humanitarian Affairs and Social Development in the African Union, to make remarks. Let's applaud her as she comes to the podium. Thank you.
أعوذ بالله السميع العليم من الشيطان الرجيم. بسم الله الرحمن الرحيم. Honorable Mutai Kagwe, the Cabinet Secretary for the Ministry of Health of the Republic of Kenya, Honorable Ministers of Health from East Africa region, heads of the regional economic communities present here, especially AAC, senior government officials from Kenya, health partners present, the Africa CDC representatives, those who are coming from Addis Ababa, and our staff here and our coordinator for the collaborating center, representatives of the member states, distinguished invited guests, ladies and gentlemen. Assalamu alaikum wa rahmatullah. Good morning, bonjour, and karibu. I'm delighted to stand here before you on behalf of His Excellency Musa Faki Muhammad, African Union Commission. It was the official launch of the Africa Center for Disease Control and Prevention, East African Regional Collaborating Center here in Kenya, Nairobi. Congratulations to us in the African Union, and congratulations to East Africa and to Kenya as a host country. Excellencies, ladies and gentlemen, the African Union Commission, in collaboration with other partners, worked tirelessly to ensure the vision of our heads of states and government becomes realistic by establishing the Africa CDC and its regional collaborating centers. And by January 2017, Africa CDC was officially launched in Addis Ababa, Ethiopia, as part of the headquarters of the African Union Commission. It is with this great honor that today we are witnessing the launch of the Africa CDC East Africa Regional Collaborating Center. 4.5 years following the official launch of the Africa CDC. The official launch of Africa CDC happened at the beginning of my term as the Commissioner for Social Affairs. Now it is changed to be the Commissioner for Health, Humanitarian Affairs, and Social Development. For the African Union Commission, and I am privileged and honored to be part of its growth and observe the tremendous progress made on its establishment and operationalization. From the Secretariat in Addis Ababa to the regional collaborating centers, including the one that we are launching today. And Excellencies, I believe you all know that we have one regional collaborating center in each of our 5 regional in 5 regions. We have Zambia for Southern Africa, we have Gabon for Central Africa, we have Nigeria for Western Africa, we have Kenya for Eastern Africa, and we have Egypt for North Africa. And also, I believe you know that the strategy is to have from the headquarters in the African Union Commission in Addis Ababa to the regional centers in each region, then going down to build the capacity of the public health institutions and to have a mini CDC in every country in Africa, as just been said by our coordinator. Excellencies, ladies and gentlemen, the African Union Commission would like to take this opportunity to extend its gratitude to the Honorable Minister of Health of Kenya for agreeing to host and avail the resources and efforts in ensuring the East African Regional Collaborating Center is fully operational. And really, Minister, I thank you. When I met you first, you were just recently appointed, and I remember in our meeting with His Excellency, the President, I mentioned accelerating the processes for the launching of this center, and you did it, Excellency, as you promised, and as His Excellency, the President, instructed in that meeting. So thank you very much, and you deserve a round of applause. Excellencies, also I would like to thank the Africa CDC staff. I would like to take this opportunity, and this is one of my final events as a commissioner at the African Union. maybe I will have only one or two. That's why I'm taking this opportunity to give a special thank you to my staff at the Africa CDC, starting by the director and the deputy director, and all the staff of Africa CDC. Because the same day I was elected as a commissioner, the 31st of January 2017, it is the day when the former AU chair, Madame Zuma, launched Africa CDC. So thank you very much for these 5 years of a very efficient work from the staff of Africa CDC in Addis Ababa and all over Africa, because they are doing their job all over the continent. So please join me in thanking them on behalf of the African Union Commission, and give my thanks as a commissioner with this excellent staff. I learned a lot from them. I'm somebody who's coming from a non-medical background, so I learned a lot, and I believe now I can go to join one medicine colleges very easily. Thank you. Excellencies, I would like also to take this opportunity to congratulate His Excellency President Uhuru Kenyatta for his leadership on health issues, on assuming also the chairmanship of ALMA for the period 2020-2022. He set his agenda outlining 4 key results-based priority areas. And I don't want to go into the details of these areas, but it's our honor to have him as the chair of ALMA. And we are doing a great job in fighting and eliminating malaria in the continent. And today, while we are launching this regional collaborating center, I would believe that this center also will join effort with His Excellency, the President, in making sure that Africa will have a zero malaria report in a very short time. I would like also further my sincere appreciation to the African Union member states in the Eastern region, the regional economic communities within the region, including ASEA, IGAD, and COMESA. Also, I would like to thank our international partners. I would like to name WHO, but all our international partners and other public health stakeholders within the region for the support that they continuously grant to the Africa CDC in ensuring that the RCCs becomes fully functional, and the RCCs serve as a collaborative platform for all stakeholders within the region for lessons exchange, knowledge sharing, and coordinating multi-stakeholder efforts in addressing regional health security challenges. Excellencies, ladies and gentlemen, the establishment, the RCC supported region. Many of these achievements have already been just now or a few minutes ago by the coordinator. This includes the establishment of a office here in Nairobi, support to member states in their preparedness and response to COVID-19 pandemic. This support includes the implementation of the Africa Joint Continental Strategy for fighting coronavirus outbreak, which was launched during the African Union Emergency Ministerial Meeting for the Ministers of Health, of which the African Union convened at the beginning of this pandemic. And as also you all know that we have started really very early. One case in Africa, the Africa CDC convened a Minister of Health meeting. It was attended by His Excellency Moussa Faki and also by Dr. Tedros and Dr. Meweti, and it was where we adopted our continental strategy to fight COVID-19. Excellencies, as our commitment to controlling the ongoing pandemic, the African Union Commission through Africa CDC has supported in this region the member states in different aspects, including deployment of over 4,000 community health workers and 36 experts on different areas of rapid response. Also strengthening surveillance systems for early detection, contact tracing, clinical case management, expansion of the COVID-19 testing capacity, and I can go on and on for a long time, but I believe all of you as people who are working in the health sector, you know what Africa CDC is doing and what are they planning to do. Excellencies, honorable ministers, ladies and gentlemen, I would like to end my speech by reminding all of us that health is both a security and a developmental, social, and economic agenda. The continental, regional, and national development agendas will be realized if we create safer environment, allow economy and livelihood to prevail without being hampered by public health events, as it has been demonstrated during this time of COVID-19 pandemic. The COVID-19 pandemic is not ready to end in Africa or globally, but in Africa is not ready to end until there is a universal rollout of vaccines that protect populations and drive herd immunity. Africa needs to produce COVID-19 vaccines at scale and affordably so that they are available where needed and widely deployed in local communities. To protect people's lives, effective and safe COVID-19 immunization should be considered a global public good, and vaccines must be produced in larger volumes, distributed according to ethical and epidemiological criteria, and supplied at no cost to users. That's why we are accelerating, Excellencies, the establishment of the African Medicine Agency, AMA. To date, we have 24 countries that signed AMA Treaty. 18 of these 24 ratified, 13 deposited their instrument of ratification. We are just short of 2 countries for AMA to come into force, and hopefully in the coming 2 weeks, we'll have these 2 countries. Excellencies, finally, let me express my sincere appreciation again to His Excellency, the Minister, on behalf of the government of Kenya. I thank through him all the departments of the government. Honorable Ministers of Health here present, thank you very much. The regional economic communities, thank you. Our collaborating partners, members of the press, and all participants for making your time to participate in this historical occasion. I would like also to assure you that the African Union Commission, through the Africa CDC and its regional collaborating centers, will continue to support all the member states of the African Union in ensuring that the continent is fully capacitated to prevent, to protect, and against any future epidemics, and to build the health capacity of the continent. Thank you very much for listening, and shukran jazilan. Assalamu alaikum wa rahmatullah.
Thank you very much, Your Excellency, Madam Amira, for those kind remarks. Again, let's applaud her with another round of applause. We are now ready to set up again for Dr. John Ngengasong on behalf of Africa CDC to make remarks. Kindly bear with us as we set up.
Can you hear me now? Hello? Can you hear me now? Hello, everyone. I think everybody else is hearing me except the people in the room.
You can see? Thank you. Your Excellencies, the ministers, and our guests. You may not get that opportunity, but let's proceed. Kindly, John, proceed.
Can you hear me now? Hello?
John, we can hear you very well.
Well, we'll just proceed. I think that, Excellency, honorable ministers, our dear partners, Excellency Commissioner Amira El Fadi Mohammed, distinguished participants, greetings from Africa CDC in Addis Ababa. This is a historic day for Africa CDC, as Commissioner Amira has mentioned. We find ourselves in a very difficult situation where for close to 2 years, we have been fighting a terrible pandemic. When our head of states and governments launched Africa CDC, this is exactly the kind of crisis they had anticipated in their wisdom and vision to create Africa CDC. It is now obvious, it's no longer theoretical, that disease threats are a threat for human health and a threat for our economic development. Distinguished colleagues, we need to redesign our health security apparatus at 3 levels. First, at global level, at regional level, and sub-regional level, and at national level. This is exactly why the regional collaborating centers are so critical to our efforts to fight the disease threats and ensure our health security. The principles of good public health practice are universal, but the implementation is local. That is why the RCCs must be strengthened to play that critical role, which says that public health is local. We have seen the challenges posed to us by the COVID-19 pandemic. It has taught us 3 lessons. One, that we are more connected than everyone thought we were, that we are more vulnerable regardless of whether you're living in the global north or global south, and that the inequities that exist between countries, between regions, and even within the same countries are so profound. As such, Africa CDC, honorable ministers, has been calling for a new public health order since its creation. A new public health order that will ensure our health security of our continent in 4 dimensions. One, the need to focus on the workforce development. As a continent of 1.2 billion people, Excellencies, we only have 1,900 epidemiologists. We need 6,000 epidemiologists. And the regions and the regional collaborating centers can play a critical role in enhancing that. Second is strengthening our national public health institutes. We said that before the pandemic. We are saying it again during the pandemic, and we'll continue to say it, that we have to have each of us, our member states, a national public health institute that does 4 things. House an emergency operations center, conduct surveillance, enforce our laboratory networks, and work in good epidemic intelligence using good data. And lastly, that we must commit to strengthening these systems with the understanding that it is an investment, that strengthening our health system is truly an investment. COVID-19 has taught us that lesson. Excellency, let us take a look at the past close to two years that we have been fighting COVID. The COVID-19 pandemic has taught us some key. First of all, that it is important to have multilateral approaches, but it has also exposed its limits. The second is that regionalism works, that we can actually take collectively the destiny of our continent in our hands. So let me just comment on regionalism. When COVID-19 hit the continent last year, under the leadership of President Cyril Ramaphosa and Chairperson Moussa Faki, a couple of regional initiatives were put together, including the COVID Fund, the African Vaccine Acquisition Task Team, the African Medical Supply Platform. Through these initiatives and many others, we as a region have been able to fight this epidemic or pandemic with resilience. Such initiatives must be sustained and supported both by the regional collaborating centers and the Africa CDC headquarters. We have seen the importance of multilateralism by its limits. We were promised vaccines that by now, as a continent, we would be receiving 300 million doses of vaccines from COVAX. As we speak today, COVAX has supplied us with 30 million doses across 44 member states. We just know last week that that number will actually even reduce. The prediction for the supplies will actually reduce. So I say this point to make the point that we have to collectively take our destiny into our hands if we have to guarantee the health security of our continent. And the regional collaborating centers must play a central role in this. Let me just end my remarks by highlighting the 4 key areas that the regional collaborating centers must focus on. One is to work very closely with the regional economic blocs and support them so that they can implement their vision. Second is to align and work together so that we can harness the assets that exist within each region in the spirit of strengthening what we're calling the Regional Integrated Surveillance Network, RISNet. That is the weapon that will bring all the assets that we have in the region together to respond effectively to any disease threat. Thirdly, to work together with the headquarters to improve our workforce development. We are in chronic shortage of epidemiologists, laboratory healthcare workers, as well as public health informatics experts. And lastly, what I call knowledge management. We need to know what exists in each region so that we can better tap on it. These are the 4 areas that we believe will contribute to the strengthening of the RCCs and improved health outcomes in each region. Let me just conclude by thanking those who have organized this meeting, starting with our coordinator, Dr. Acham, Dr. Justin Maeda, Dr. Ahmed, and a whole host of others that have been working day and night to make this meeting a success. I thank you so much for your kind collaboration.
Thank you very much. Thank you very much, John. Indeed, it has been possible, and COVID-19 has taught us it is very possible, and you have rightly outlined that before COVID, we thought we were not as much connected, and courtesy of COVID, we are able to have you as a guest and follow the workshop online. Now, it's my humble pleasure to invite the Cabinet Administrative Secretary in the Ministry of Health in the Republic of Kenya, Dr. Rashid Aman, to make remarks. and kindly request you to take over the program from there, Dr. Rashid. Thank you. Let's applaud him as he comes to the podium.
Thank you, Dr. Mulwa. Our Honorable Minister for Health in Kenya, Mutahi Kagwe, and our chief guest today, Your Excellency, the AU Commissioner for Health, Humanitarian Affairs, and Social Development, Honorable Ministers of Health, the PS of the Ministry of East African Community officials, Africa CDC representatives, representatives of development partners present, distinguished guests, ladies and gentlemen. I'll be very brief. We are gathered here today to mark another milestone in the operationalization and implementation of the AU Heads of State and Government Decision 554 adopted during the 24th Ordinary Session of the Assembly held in Addis Ababa, Ethiopia in January 2015. This decision established the hub and spoke model of the Africa CDC and its regional collaborating centers as specialized technical institutions of the African Union to support public health initiatives of member states and strengthen the capacity of their public health institutions to detect, prevent, control, and respond quickly and effectively to disease threats. The Eastern African Regional Collaborating Center, which is officially being launched this morning, coordinates Africa CDC partnerships and activities in the 14 member states in the Eastern African region, as we heard earlier. The COVID-19 pandemic, with its devastating health and socioeconomic impacts globally, regionally, and nationally, has put a damper on strategies and plans for health and economic growth in many of the AU member states. This pandemic has indeed reinforced the AU ideal of promoting regional, continental, and global cooperation, for no country alone can battle highly infectious diseases that respect no borders. This launch today is a welcome and timely initiative, for it starkly demonstrates in this pandemic era the need and place for such institutions to collectively address challenges of battling old, new, and emerging diseases with potential to becoming epidemic or pandemic. We are confident that the Africa CDC and its RCC, working in partnership and synergy with the national public health institutions, will live to this expectation. Let us also recognize and commend the excellent work done by Africa CDC in supporting member states in their COVID-19 responses. I would like to, and then thank you all, but before I leave the podium,
Dr. John Kengasong, the Deputy Secretary General of the East African Community, here with us present, Christophe Osivamo, representatives of development partners here present, distinguished guests. It is indeed a pleasure for us to all those very distinct but in and start to allow me especially recognize those colleagues of mine who are here present physically, and to just at least for you to see them. I think it would be very unfortunate if ministers traveled all the way and because of something called time, we are unable to recognize them. So I would like, with no particular order, to recognize my sister, Dr. Leah Tandese from Ethiopia. If you could just at least stand up, Leah. But Dorothy Banjima. Dorothy, will just stand up. My sister from Uganda, Anifa, if you could just stand up. I would also, in just to balance gender today a little bit, I would also like to ask Christophe. Please, Christophe, just stand up from the EAC. Thank you. Thank you very much indeed. It is a pleasure to join you all on this very momentous occasion of the official launch of the Africa CDC, Eastern African Regional Collaborating Center in the Republic of Kenya. As a country, we welcome all the representatives here today from the different countries across the region. Karibuni, Kenya. Today's launch represents a new frontier of the Eastern African nations in the fight against emerging and re-emerging long-standing health threats. As a country, we are both honored and privileged to be launching the Africa CDC, Eastern African Regional Collaborating Center. This occasion highlights the fruitful and dynamic cooperation between the government of the Republic of Kenya and the African Union Commission. I do hope that the center will serve its purpose in strengthening the capacity, capabilities, and partnerships of Africa public health institutions to detect and respond quickly and effectively to disease threats and outbreaks in the continent. The opportunity to collaborate in disease control is something we have been looking and doing, and I believe the center will have a positive impact, not just in the region, all our continent, but indeed globally. We would like to see greater cooperation, not just between member states covered by each of the centers, but also greater cooperation between the centers themselves. This is important because whereas the regional centers take care of their respective regional issues, the collaboration between the centers themselves would allow for collaboration across the entire continent through us and Speaker John Kengasong referred to the issue, and Amira also referred to the issue of how we must be properly coordinated, if indeed, otherwise we'll have separate RCCs operating on their own, and that's not the intention. The main theme of the event today is ensuring effective preparedness and response to current public health threats in the context of COVID-19 and beyond. This is apt because over the past year, we have witnessed the mounting health and economic toil of COVID-19 in our continent. The COVID-19 pandemic is indeed a stark illustration of how the undetected transmission of pathogens across borders can quickly transform regional health emergency or even a global crisis. The current situation underscores the importance of strengthening regional emergency response capabilities across the continent. As we recover, hopefully, from the devastating impact of the pandemic, there is growing pressure on governments and regional bodies to safeguard the health of Africa and the world. The challenge of regional disease surveillance and control is now at the forefront of policy discourse around global public health. Policies must be put in place to ensure that continental institutions can swiftly detect and effectively address disease outbreaks anywhere before they become a threat everywhere. For this reason, there is a need for quality information and data, as well as knowledge and information at all levels, from the community and national and regional to the continental levels. This would ensure that all public health decisions are guided by evidence-based policies and guidelines. The Eastern African RCC should serve as a platform for information and knowledge sharing. Colleagues, ladies and gentlemen, it is time that we as Africa begin to realize our strengths and our weaknesses when it comes to peace. Weakness lies in no boundaries. You met regarding malaria. A mosquito, unlike you and I, does not carry a passport and crosses the borders with or without a passport, with or without malaria-causing effects. And therefore, we must appreciate that there lies some weaknesses that are not within our control. But we also recognize our strength. And means that a disease outbreak in one country is a potential risk to the other and the entire region. We have indeed seen this with diseases such as Ebola, Rift Valley fever, COVID-19, polio. These disease outbreaks over the years have made the case for building an interconnected network for identifying, monitoring, and addressing infectious diseases and disease outbreaks in Africa. Our strength, on the other hand, lies in our realization of the need to work together in the knowledge that there is no disease or challenge that together regional cooperation plays an indispensable role in Africa. In the words of the former States Attorney General, John Ashcroft, and I quote, "If necessity is the mother of invention, it is the father of cooperation," end of quote. We have to come together to share knowledge and harness Africa's public health resources to inform countries and development partners in their efforts to enhance regional disease control systems across the continent. That indeed, working together, not just in combating disease, but also in other spheres of life, creates a huge opportunity for our people, which will go a long way in changing the way we think and therefore the way we live. The center, by its very nature, is a research institution that of necessity must be supported by adequate laboratory capacity. In this regard, I'm pleased to note that the regional laboratory that will also be established will, among other things, undertake to better understand disease, the case with COVID. Besides, I expect that the center will also collaborate with our research institutions, including those in Kenya and elsewhere, the Medical Research Center here, the Kenya Institute of Primate Research, and other research bodies whose work will be complementary to that of the Regional Collaboration Center. It should also act as a reference and referral laboratory for our region. At the center of all these efforts is the ultimate goal of ensuring that we approach seeking solutions to our health challenges differently together. Given its research objective, the Regional Collaboration Center will also enable us to share and learn from each other as we seek to develop our individual countries' healthcare systems. As the Kenya government, we are witnessing the efficacy of having enabling legal and institutional mechanisms such as the Kenya Vision 2030, Kenya Health Policy 2014-2030, and our Big Four agenda set by President Kenyatta, which have put universal health coverage at the center of our health systems. This has helped us minimize the fatalities and cushion our people from heavy and indeed dangerous financial burdens from health complications, especially during this period. While we are proud of our success stories, we want to share our best practices and we wish to learn from each other. In this regard, I expect that the Africa CDC, Eastern African Region Collaborating Center, will continue to offer a platform in networking the public health assets in the region, as indeed was mentioned by Dr. Nkengasong. In the East African region, we have able laboratory systems that can be networked to strengthen diagnostics. The vision of a regional referral laboratory in the East African region is a noble idea that we all need to support, and it will ensure effective preparedness and response to current and future public health challenges. In the context of COVID-19 and beyond, we must work together towards our vision in Agenda 2063, and I quote, the Africa we want. I believe the dream of our forefathers had of an African institution to handle an African health security framework has finally arrived. I call on my colleague ministers in charge of human, animal, and environmental health to support this center to effectively deliver its mandate. This support may be financial, but it might also be in kind. Let us not abandon this baby, not in its infancy, childhood, or not at all. Ladies and gentlemen, Kenya is very proud to have been identified to host this center on behalf of the region. We shall play our part as a people and as a country to ensure that this collaboration center succeeds for our common good. In this regard, we are committed to providing the necessary support. And I would like here to announce, and I did say yesterday, Amira, you'll be happy to know that President Kenyatta has directed and ordered that the center, we have been given choice. Not only have we given you the opportunity, we are even giving you a choice of where you want to be located and the lands that you want. So, this directive I was given this morning and asked to say hello to you by His Excellency, the President. I hope you accept. And during the period, where before, and indeed, I would also like to mention here that the president not only directed that the regional office being given sufficient land for use, and he said, I don't want to hear about 1 or 2 acres. I want them to be given land that they can use today and in the future. In addition to that, he told me to say today that he actually wants to ensure that he breaks ground on the center in the soonest possible time. And in the meantime, we have provided logistical support. I know that we have given you a floor somewhere in our annex. And if you need any more, we are also here to provide the same. We have given you office space, interim personnel, besides other office amenities towards the operationalization of the regional center. We know that this center will not only be of benefit to health questions, but it will also go a long way to providing opportunities, employment, and so on for people across this region. And this is a good thing. And to our people in Kenya, this is a center to embrace and support in our usual welcoming way and provide all the support to the people who will be working within that institution. As I conclude, I want to thank the governments of the East African region, the leadership and staff of the African Union, Africa CDC, our partners, stakeholders, as well as well-wishers for making this milestone possible. And it now gives me great pleasure to now declare the Africa CDC Eastern African Regional Collaborating Center officially launched. Asanteni.
And stream. Okay. Yeah, good.